When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 obstetrics questions. This is just a reminder that you can find these questions and many more at medprep2go.com. If you're interested in getting involved in this project and learning how to develop questions, please contact me at ted.medprep2go@gmail.com. And just a request to let your friends know about this project and to consider giving us a review because all of that helps a lot. All right, let's go ahead and get started with the first question. A 31-year-old woman presents for obstetrical care for the first time and is found to be at 28 weeks gestation. She has no current complaints, but reports a history of photosensitive malar rash, polyarthritis, cold fingers, and depression. She takes hydroxychloroquine and low-dose prednisone. Physical examination is unremarkable except for a gravid uterus, a painless aphthous ulcer in the mouth, and mild Raynaud phenomenon in the distal fingers bilaterally. Fetal auscultation reveals bradycardia. Laboratory evaluation of the patient reveals a mild microcytic anemia, positive antibody titers for anti-nuclear, anti-double-stranded DNA, anti-Rho/SSA, and anti-LA/SSB antibodies. Which of the following interventions is most likely to be required for the infant after birth? A. Administration of intravenous indomethacin. B. Administration of surfactant. C. Evaluation for renal transplantation. D. Initiation of lifelong anticoagulation. Or E. Placement of a cardiac pacemaker. The correct answer is E. Placement of a cardiac pacemaker. This patient has systemic lupus erythematosus, or SLE. SLE can present in many ways, though classic findings include a photosensitive malar rash, Raynaud phenomenon, and polyarthritis, and aphthous ulcers. Labs may include cytopenias, such as anemia, and tests for specific antibodies, such as anti-nuclear antibody, anti-double-stranded DNA, and anti-Smith are often positive. Patients with SLE can also have anti-phospholipid antibody, and the antibodies anti-Rho/SSA and anti-LA/SSB, which are typically associated with Sjogren syndrome. Pregnant women who are anti-Rho/SSA or anti-LA/SSB positive are at risk for delivering infants with neonatal lupus, an autoimmune disease resulting from passive transfer of autoantibodies from the mother to the fetus, resulting in fetal and neonatal disease. The major manifestations are cardiac and cutaneous findings, with the most serious complication being complete heart block. Patients with neonatal lupus may develop first, second, or third degree heart block, most commonly occurring between 18 to 25 weeks of gestation. Complete heart block results in fetal bradycardia that can be detected by routine fetal auscultation, though frequent fetal echocardiographic surveillance is advised for individuals who test positive for Rho/SSA and LA/SSB autoantibodies. Complete heart block is treated with a cardiac pacemaker. Answer choice A, administration of intravenous indomethacin, is incorrect. Indomethacin is used to close a patent ductus arteriosus. SLE is not known to significantly increase the risk of patent ductus arteriosus development in offspring. Answer choice B, administration of surfactant, is incorrect. Surfactant is used in neonatal respiratory distress syndrome. SLE is not known to significantly increase the risk of neonatal respiratory distress syndrome development in offspring. Answer choice C, evaluation for renal transplantation, is incorrect. While SLE often affects the kidneys, neonatal lupus typically does not include congenital renal involvement. Answer choice D, initiation of lifelong anticoagulation, is incorrect. Antiphospholipid syndrome in the setting of SLE is associated with an increased risk of arterial and venous thromboembolic events. In the absence of a thrombotic event for antiphospholipid defining pregnancy morbidity, such as recurrent pregnancy loss, anticoagulation usually is not indicated. It would not be routinely indicated for an infant born to a mother with SLE. The key learning point for this question: pregnant women with systemic lupus erythematosus who are positive for the anti-Rho/SSA or the anti-LAW/SSB antibodies are at heightened risk of delivering an infant with neonatal lupus. The most concerning feature of neonatal lupus is congenital heart block. High-grade heart block, which presents with fetal bradycardia, typically requires cardiac pacemaker implantation. Question 2. A 48-year-old woman, gravida 1, para 1, comes to the office for evaluation of increasingly heavy menses. For the last 6 months, her menses have lasted for 4 to 5 days, occurring every 20 to 25 days, with heavy bleeding, cramps, and passage of clots. Her last menstrual period was 2 days ago. She had one cesarean delivery 20 years ago for the birth of her daughter and states she does not desire any more pregnancies. She takes lisinopril for hypertension, which is well controlled. She does not drink alcohol or use tobacco or illicit drugs. Temperature is 37.1 degrees Celsius or 98.6 degrees Fahrenheit. Blood pressure is 118 over 72 millimeters of mercury. Pulse is 112 beats per minute. And body mass index is 26 kilograms per meter squared. On physical examination, the patient appears pale and fatigued. On pelvic examination, the uterus is mobile and appears uniformly enlarged. Speculum examination reveals a normal vagina and cervix. Transvaginal ultrasound is performed and reveals an enlarged uterus and asymmetric thickening of the myometrium, consistent with adenomyosis. Which of the following is a possible treatment option for the patient? A, expectant management. B, fallopian tube ligation. C, hysterectomy. D, intrauterine device. Or E, oral contraceptive pills. The correct answer is C, hysterectomy. The correct choice of management for this patient would be a hysterectomy. The patient is likely suffering from adenomyosis, a condition characterized by the abnormal presence of endometrial glands within the myometrium of the uterus, leading to dysmenorrhea and heavy but regular menstrual cycles. The loss of blood can lead to anemia, possibly present in this patient given her appearance as pale and fatigued. Adenomyosis is usually seen in women over the age of 40 years. Transvaginal ultrasound is the first-line imaging for evaluation of an enlarged uterus, abnormal uterine bleeding, and/or pelvic pain. MRI can also be used, but is typically reserved for patients in whom it is important to distinguish between focal and diffuse adenomyosis, or between focal adenomyosis and leiomyomas. Histopathology can provide definitive diagnosis of adenomyosis by showing endometrial glands within the myometrium. Endometrial biopsy is not informative in the diagnosis of adenomyosis, but is often required when abnormal uterine bleeding is present in order to exclude endometrial hyperplasia or carcinoma. For women with symptomatic adenomyosis who have completed childbearing, hysterectomy is a definitive treatment option. Answer choice A, expectant management, is incorrect. This is usually not considered for cases of adenomyosis, as a large amount of blood loss leads to anemia, fatigue, and discomfort to the patient and would not be improved with expectant management. Answer choice B, fallopian tube ligation, is incorrect. This has no effect on the disease pathology with adenomyosis, since the fallopian tubes are not part of the uterus. Answer choice D, intrauterine device, is incorrect. While an intrauterine device containing progesterone might be used to alleviate symptoms, it is usually part of management in women who desire future childbearing. For women who have completed childbearing and are symptomatic, hysterectomy is a definitive treatment option. Answer choice E, oral contraceptive pills, is incorrect. Oral contraceptive pills may be tried as a second-line treatment in symptomatic adenomyosis in patients who desire future childbearing, but they are not the treatment of choice for symptomatic patients who have completed childbearing. The key learning point here: for women with symptomatic adenomyosis who have completed childbearing, hysterectomy is a definitive treatment option.
In Walmart's Newville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North, could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart, who knew? Subject to availability, terms and fees apply.
Abercrombie Kids is bringing the cheer all holiday season, and the gifts too. No matter how long their wish list is, there's always room for just one more. Whether it's a new winter coat, an extra pair of jeans, or cozy matching sweat sets, get gifting with looks they've been waiting for all year. Shop Abercrombie Kids in the app, online, and in stores.
Question 3. A 38-year-old woman, gravida 3, para 2, at 28 weeks gestation, presents to the clinic for a prenatal visit. She is concerned about swelling of her hands and feet, which began 2 days ago. She denies shortness of breath, dizziness, or loss of consciousness. Past medical history is significant for 2 prior pregnancies that were uncomplicated. She takes a prenatal vitamin daily. She does not drink alcohol or use drugs, but did smoke a half pack of cigarettes daily and stopped when she found out she was pregnant. Family history is significant for a cesarean section delivery in her mother at age 26 years for eclampsia and a diagnosis of hypertension at age 47 years. Vital signs are temperature 37.1 degrees Celsius, which is 98.6 degrees Fahrenheit, blood pressure 159 over 100 millimeters of mercury, pulse 95 beats per minute, and respirations 18 per minute. Pelvic examination shows a uterus consistent with a 28-week gestation. Fetal heart rate is 152 beats per minute. Labs are done, and the results are as follows: hematocrit 35%, leukocyte count 10,000 per cubic millimeter, platelets 158,000 per cubic millimeter, creatinine 1.0 milligrams per deciliter, AST 20 units per liter, ALT 18 units per liter. Urinalysis shows a specific gravity of 1.012, red blood cells 1 per high-powered field, white blood cells 0 per high-powered field, and protein 4+. Which of the following is the most appropriate next step in management? A, admission to the intensive care unit. B, cesarean delivery. C, hydrochlorothiazide, D, induction of labor, or E, labetalol? The correct answer is E, labetalol. This patient is presenting with preeclampsia without severe features. Management is dependent on the hemodynamic stability of the mother and the fetus, the age of gestation, and the presenting symptoms. Because the mother is stable and the gestational age is less than 37 weeks, conservative treatment is appropriate. Antihypertensives like labetalol, hydralazine, or methyl-dopa are the mainstays for lowering blood pressure. Magnesium sulfate for prophylaxis of seizures and dexamethasone for fetal lung maturity should also be administered. Answer choice A, admission to the intensive care unit, is incorrect. Admission to the ICU is not warranted as this patient is stable and is not presenting with severe features such as elevated creatinine, hepatic dysfunction, new onset headache or visual disturbances, a platelet count less than 100,000, or pulmonary edema. Answer choice B, cesarean delivery, is incorrect. Cesarean delivery is not appropriate as urgent delivery is not necessary and will only cause harm to the fetus as it is preterm. Answer choice C, hydrochlorothiazide, is incorrect. Hydrochlorothiazide is a diuretic used to manage hypertension, but is advised as a second-line agent in pregnant patients. Answer choice D, induction of labor, is incorrect. Induction of labor is not appropriate as urgent delivery is not necessary and will only cause harm to the fetus as it is preterm. The key learning point here: patients with preeclampsia without severe features are managed based on stability of the mother and the stability and age of gestation of the fetus. Conservative management focuses on lowering blood pressure with labetalol, hydralazine, or methyl-dopa. Okay, that's it for this episode, but please do check out our other episodes as well as our many questions that are available online at medprep2go.com.
So you want to start a business. You might think you need a team of people and fancy tech skills, but you don't. You just need GoDaddy Aero. I'm Walton Goggins, and as an actor, I'm an expert in looking like I know what I'm doing. GoDaddy Aero uses AI to create everything you need to grow a business. It'll make you a unique logo. It'll create a custom website. It'll write social posts for you and even set you up with a social media calendar. Get started at GoDaddy.com/Aero. That's GoDaddy.com/AIRO.